Hello, myself, August. Today, I would like to introduce Dr. Sumeet Jain, Associate Professor, Surgery Oncology, DMCH Cancer Care Center, in collaboration with the American Oncology Institute, Ludhiana. Today, we will discuss about a very common cancer in women, that is breast cancer. So, good afternoon, sir.
Good afternoon.
Sir, what are the most common symptoms of breast cancer?
Breast cancer is a very common, actually, it's the most common cancer nowadays in women. And the most common symptom is actually a breast lump or swelling, which we call a lump or swelling, which a woman can actually feel and palpate. The important thing about this swelling is it's actually painless. It does not cause any pain. So a painless lump, which is increasing in size over a short duration of time, is actually the most common symptom of cancer. If we ignore the symptom, the cancer can progress. Then we can have late symptoms, which is in the form of ulceration or function in the breast, pain in the breast, swelling in the breast, or if the disease spreads to any other organ like bone, then we can have bone pains. If it spreads to liver, then we can have jaundice. And if we have spread to lungs, it could cause chronic cough. So these are actually the lead symptoms of cancer, but the earliest symptom is a painless lump in a breast which a woman can feel. Nowadays, there is also a concept of doing mammography, which is called screening. So screening is actually advocated, but that is only after age of 50 years of age. We don't advocate screening less than 50, and if it's done up to 50 years, it's once in 2 years. So this is an investigation which can tell us if the cancer is developing even before the woman can palpate it. So it's one of the modality to detect cancer when it actually can be fed by a woman. So these are all the symptoms and how we can know if there is something wrong in a breast.
Okay, sir. Sir, when does a patient visit a surgeon?
So if a woman, what we advocate nowadays is every woman should do a breast self-examination. She should palpate her own breast, and if she feels that something is not normal, she feels some guilty edge, lump here, that is a time when he needs to visit a surgeon, take his or her opinion, because they are the best people to guide whether this lump is actually cancer or it's a normal lump. It can also occur very commonly in women.
G. Sir, what is the difference between a benign and a cancer swelling? How is it diagnosed?
So it's a good question, because a lump in a woman does not always mean cancer. What we benign means it can be also a non-cancer lump.
Yeah.
So a non-cancer lump is that which is a normal swelling which can either progress or digress or अपने आप decrease हो सकता है. So that is a benign swelling. But the cancer swelling will never decrease in size. It will continue to increase in size and it spread to other organs. So the best test to diagnose is a needle test, in which a needle is put in the lump and a small tissue is taken and seen under the microscope by the pathologist. So this is a test we can tell us whether it's a cancer or not cancer. There are two types of needle tests. One is fine spacious cytology, and other is a core biopsy. So core biopsy is actually a better test to find out whether the swelling is actually a cancer or a non-cancer. It is actually a daycare procedure. It's an operating procedure. It can be done in around just 5 to 10 minutes, and it can tell whether the lump is actually cancer or it's a normal lump which we don't need to treat or just need to follow.
G. Sir, what are the common investigations which are done, and how is it the staging done?
So when we know there are two types of investigations actually for a cancer. One is to confirm whether the lump is cancer or not, and second is to stage the disease, how far it has spread. So as I told you earlier, the test to diagnose that when we diagnose breast cancer is a needle test. So that is a mandatory test if we need to find out whether the swelling or the lump in the breast is cancer or not. Once we know that the lump is cancer, then we need to stage it. Now, staging is another set of investigations. They can be basically radiological investigation that depends on the size of the lump. And what is this? If the lump looks small, it's around 1 to 2 centimeters, we know the chances of it spread are less. In that case, we can do ultrasound of the abdomen and chest X-ray to find out that there is no lesion in the lung or a liver or in the other part of the abdomen. And if the stage is higher, then we need to escalate our investigations. That can be in the form of a CCT abdomen or chest, or a PET scan where the facility is available. So these are the investigations which can tell us whether the cancer is limited to breast or it has spread to some other parts of the body. So depending on the stage, then we have to plan a treatment.
G. Sir, what are the treatment options for the cancer and how long will the surgery take?
See, the treatment option for cancer depends on staging. And today, not only on staging, we have some special investigations which are called estrogen receptor, progesterone receptor, and continuous receptor status. So, by and large, we divide patients into early breast cancer, locally advanced breast cancer, or metastatic breast cancer. Metastatic breast cancer means when the cancer has spread to other parts of the body, like liver, lung. In that case, the only option is chemotherapy. We don't do any surgery. And if patient has some pain in the bone, then it's radiotherapy. This is a scenario for a metastatic breast cancer when the cancer is spread. Locally advanced means the lesion is very big. It cannot be operated upfront. So in that case, we have to decrease the size of the lump. So we give the patient chemotherapy to decrease the size of the lump. And if the response is good, then we go ahead and do surgery. Now we have third option is early breast cancer. That means it can be operated upfront. So most of the early breast cancer undergo surgery upfront, but there are some scenarios like some patients who are septin positive and their size is more than a centimeter. In that case, we may give chemotherapy and then do surgery, but doing surgery upfront is also an option in those patients. So depending on the stage and the different parameters, we decide whether the patient has to undergo surgery or has to undergo some other treatment in the form of chemotherapy. And hence, when we talk about surgical options, then we have breast conservation also. In that case, we don't have to remove the entire breast. We just remove the lump along with the lymph nodes, and the breast can be preserved. Second option is removing the entire breast. That is called mastectomy. So that is the treatment options we have for patients who undergo surgery.
Sir, how long will the surgery take?
Surgery generally takes around 1 hour to 2 hours, depends on the patient to patient, and especially today and how long depending on what procedure are we doing. If someone undergoes reconstruction at the same time, like complete breast is removed, then he wants to reconstruct the breast, then it takes longer because that will require plastic surgery collaboration also. So it depends on what surgery we are planning and the patient's status.
Sir, how will the surgery affect my patient appearance and are there any long-term side effects of surgery?
So the main thing about breast surgery is the breast is an external organ. It actually sees, so it's actually a cosmetic organ. So once we remove the entire breast, then obviously there is asymmetry on the two sides. So to overcome that, today we have external processes which can be fitted in undergarments, or then we have a option for reconstruction with implants which are placed inside the body or using a body's own tissue to form the breast. So if the patient is actually willing for reconstruction, we can actually do that and they don't have any cosmetic deformity. And if the lump is small, we can actually preserve the breast. As I told you, it's called breast conservation. So we have plenty of options available so that the patient does not have any effect on the patient's appearance. With regard to long-term side effects, the most dreaded side effects was developing swelling in the operated arm, which was called lymphedema, which was due to removal of the nodes in the axilla. But now we have technology. If the patient does not have any nodes in the axilla, we can actually do what is called a sentinel lymph node biopsy. In that case, we send the patient in the morning to a nuclear medicine department. They put a dye in the breast and they localize the lymph node. And then the patient comes to us in the operating room. Patient is given anesthesia and we take out the marked lymph node and send it for frozen testing, which is called histopathologic examination. If the nodes are not harboring any cancer, then we don't need to actually remove the lymph nodes. So that actually helps to prevent the swelling in the arm, and the long-term quality of life is actually good. So the long-term side effects are actually coming down and they are not major now. So if the patient comes to us early, the side effects are also less. If the patient comes to us late, then side effects of treatment are actually more. So it also depends on the stage at which the patient presents to us.
Okay, sir. Sir, does the patient have to undergo further treatment after surgery? If yes, what is that?
See, surgery is not the only modality of treatment in any cancer. Cancer needs to, as these are trimodality, which means surgery, chemotherapy, and radiotherapy. So all these treatments are not mandatory in every case. It actually depends on the stage. So surgery is a must in any localized or locally advanced breast cancer. So depending on the report, the principal histopathological report which comes after the surgery, the patient may have to undergo chemotherapy or radiotherapy. But it's not mandatory in our cases. It depends on the final histopathology report. If the patient presents to early is a stage 1 cancer and has good prognostic factors, then he may not require any further treatment. But if the factors are not good, he may require chemotherapy or radiation therapy.
Ji. Sir, what are the chances of survival after the completion of the treatment?
See, survival is directly dependent at which the patient presents to us. So if the patient is stage 1, it's 90 to 95% cure rate after completion of treatment. If the patient presents to us at stage 4, population survival comes down. So chances of survival, so that's why we say the earlier the patient presents to us, the lesser is the treatment, the longer is the survival, and the cost of treatment is also less. So the later the patient presents to us, and treatment is expensive, it's more aggressive, and survival is less. So best is that if someone has any lump, he should at least take the opinion of an expert to rule out it's not cancer.
Thank you, Dr. Sumeet Jain, for the interactive section and giving us such a valuable information.
So just I want to concluding a point that any woman, please don't ignore any lump, because what the common belief in our country is that if the lump is not causing any pain, it's harmless. But it's the other way around. If the lump is not causing any pain, it's more dangerous. So please contact the expert, get an opinion that it's not something which we don't want to accept.
Thank you, sir.
Thank you.